Good afternoon, everyone, and welcome to Bariatric Friday. I'm Kemal Erkan. Today, we are going to take a deeper look at something that is extremely important in bariatric surgery, but it's not always talked about enough. The care coordination behind successful outcomes. Many people think bariatric surgery is only about the operations itself. But in reality, surgery is just one part of the journey. Long-term success depends on communication, education, patient engagement, follow-up care, and the coordination between many different healthcare professionals. So today, we will talk about how modern bariatric programs build a stronger support system around patients before surgery, after surgery, and throughout their long-term health journey. Joining us today is Dr. Irgau, as usual, and Dr. Irgau, thank you for joining us today. How are you doing?
I'm doing great. My pleasure. It's humbling to follow on the esteemed interview you had with Senator Coons just before this show.
Of course. Thank you for, again, being with us. So if you weren't here all the time, we wouldn't be able to get those interviews done.
Thank you.
So today we are going to talk about the emotional and psychological side of bariatric care, and at least we'll start with that.
Yep.
Bariatric surgery doesn't only change the stomach and or the digestive system, but it's also changing the behavior overall. And what we know for all this time is what's the right way to support our patients pre, post, and long term. Mm-hmm. So my question is, why is psychological coordination such an important part of bariatric care?
Well, simply because mental health directly impacts surgical success. So having a coordinated psychological evaluation to really earlier on identify emotional eating patterns, potential issues with addition transfer risks, unrealistic expectations, or overall stress management capabilities is very important. There should be an ongoing communication between the behavioral health providers and the bariatric team, because that improves really the long-term outcome of the bariatric surgery, and it also decreases the potential for relapse of certain behaviors that they may have been present before.
So, nutritional coordination beyond the operation. This is always something that, in our other topics, when we cover bariatric surgery, we talk about. Nutrition. Last week, one of our nutritionists in Turkey, Elvan Odabaşı, was with us. I don't know if you were able to catch up with that.
I did. She was very good.
So that was actually, that's the second time we did that with her.
Yep.
And it's an interesting one because we see what we are doing here in the United States, the way that it actually is received in other countries.
Yes.
And they do follow us.
Absolutely.
So,
absolutely.
And this follow-up is important because many people think nutrition counseling is something that happens before surgery, and it's not needed for long term. But that's not what we are actually educating people with. And what we know is they need support to avoid malnutrition, vitamin deficiencies, dehydration, and weight gain. So with this, my question to you is, how does coordinated nutritional follow-up protect patients' long-term benefits and outcome?
Well, clearly, this is very important. Dietitians guide patients through staged diet progression, hydration goals, protein intake, and vitamin supplementation. Coordinated monitoring also helps to detect deficiencies early, just before they occur, and adjustments can be done on the nutritional plans the patients are on. And this changes as patients, are evolving after the surgery. Long-term nutritional support is essential after bariatric surgery, because surgery itself, as we've said many times in our shows, permanently changes the setup of our digestion, and there is always a risk for potential malnutrition, for potential deficiency of certain nutrients. And so a coordinated follow-up involving nutritionists is important in the bariatric team. And this is not just at the beginning when the patient is being prepared for surgery, but also long term. We have to partner with our patients in the long term, and that partnership has to involve the input of the nutritional team as well.
So, as you know, some of our patients, they come into the bariatric surgery with more complex medical conditions. They may have severe obesity along with diabetes, sleep apnea, heart disease, mobility limitations in some cases, and other chronic health issues. These patients require more than one physician or one visit from us. They need coordinated team approach. And this is pretty much our multidisciplinary approach. How do bariatric teams coordinate care for medically complex patients?
So the bariatric team works very closely with the different specialists, the cardiologists, the pulmonologists, endocrinologists, anesthesiologists, and primary care physicians. The goal really is to stabilize conditions before surgery, and that obviously reduces perioperative risk. All the time when I talk to patients about complications, I always tell them that the best way to take care of a complication is to prevent it in the first place and do everything that is possible to increase that prevention possibility. And this coordinated care from the different specialists on different aspects of the medical problem of the patients is extremely helpful. But as you correctly said, you have to have a good coordination to get the best out of this input from the different specialists, because each one acting in isolation may not be very meaningful in preparing the patient for that goal of having a safe surgery in the end. That structured communication ensures everyone understands the treatment timeline and the recovery plan as well.
So one area that patients may not always think about is medication management after surgery. When patients lose weight rapidly, the way medication works in their body is going to change, obviously. So blood pressure medication, insulin, diabetes medication, and even psych medications may need to be adjusted. And we actually put our updates every time we see the patients, and we are looking for resolutions, and this is something that we cover under the resolution of comorbidities. And the results are almost extremely shocking, because in some cases 90% of the patients with sleep apnea, diabetes, psych, these are in this following 6 to 9 months, almost at the resolution point. So the question I have for you is, why is medication coordination so critical after bariatric surgery?
It is absolutely critical, obviously, because patients will be experiencing very dramatic metabolic improvements quickly after the surgery. If medications are not adjusted appropriately, patients may develop low blood pressure, low blood sugar, or other complications. Probably the most common example, Kemal, is a patient who has high blood pressure. That patient is on medication for high blood pressure. Let's say that if they don't take their medication, their blood pressure is 170 over 90. That's high blood pressure, right? But when they take the medication, the blood pressure goes down to 120 over 65, which is a good blood pressure, right? But after the surgery, what happens is the surgery itself treats the high blood pressure, right? So the patient now has a normal blood pressure because of the surgery. Well, guess what? If they take their medication now, that blood pressure is going to go so low that now they have very low blood pressure, and they may start feeling dizzy, right? And even pass out. So it is important to make adjustment to the medications because of the improvements that are happening after surgery. So that coordination with the other carriers in terms of medication management is absolutely critical. So continuous communication is very important between the bariatric team and the prescribing physicians, especially in the first year when the greatest changes are occurring.
So that's, if you think about it, that's so interesting, right? So here's something that helps the patients with their chronic problems.
Yep.
But then if we are not coordinating this with the surgeons, with their PCPs, and if they have a cardiologist on board, so then everything that they started prior to surgery, or what they have prior to surgery, now if it's not adjusted in a timely manner, it may become a hurdle.
Absolutely.
Right. So
absolutely.
This is why we always tell people, not just because of the bariatric program, but even for the others, at least once a year, see your primary care physician.
Absolutely.
So
Absolutely.
at least once a year, get your routine blood work done. So because we don't want to be too late.
Absolutely.
And then you don't want to actually blame the weight loss for dizziness because you didn't adjust your hypertension medication, right? So that's kind of like funny in a not so funny way, maybe.
Yeah.
So one of the issues you and I we did deal with and discuss a lot is the patient dropouts.
Yeah.
Drop-offs. So this is a challenge for bariatric medicine, and keeping patients engaged after surgery is always difficult.
Yep.
And that's part of it again with the extreme success that we see and big weight loss that they actually encounter, and they feel like they don't want to see anyone anymore, so they're okay.
Right.
So, and this is one of the issues that we deal with, and in some ways with the transportation, financial issues, more around like this social determinant of health, that we see patients not want to follow up. So, but we know that follow-up is not optional.
Absolutely.
Right?
Absolutely. It's very important.
My question is, why do some patients stop attending follow-up visits, and how do programs address that? And in our case, American Surgery Center.
In some situations, patients may feel that they have succeeded earlier on, right, after the surgery, to get their weight off, to become healthier, not to require medication, and that may make them feel that they no longer need to be monitored. So that could be one issue. So we could be actually victims of our own success in a way, right? Because patients are feeling, well, I'm healthier now, I have lost the weight, why do I need to see the doctor, right? That could be the mentality that would push them into postponing those appointments or missing those appointments. Another could be real problems, right? There may be transportation issue, financial issue with copay and other things, scheduling problems, and obviously emotional discomfort could be another one as well. How do you take care of that? Well, that's where a strong coordination team is critical here as well, rather than having the doctor by himself and the patients trying to get together, right, with probably different priorities. As I said, the patient may not feel it is a priority right now, right? The doctor knows it's a priority, but how do we make that happen? Of course, the care coordinating team is critical here, because they will have landmarks, right, that they have to get the patient in by, right? They have to be seen at 3 months, they have to be seen at 6 months, they have to be seen at 1 year. These are not arbitrary times. These are important milestones that we have to track the patient's progress, but also make sure there are no problems that are arising, either because of malnutrition or other issues, essentially. So there may be a variety of reasons of why patients are not following, but one of the most important solutions for this is to have a good coordinator care program within the bariatric system.
Right. So let's also talk about the home environment. So family habits, social gathering, food culture, which, trust me, being in Turkey for 2 weeks, I probably gained some weight before I got back. So, and the support system, they're all playing a major role for the long-term bariatric outcomes. And the patient may be committed, but if the environment around them is not supportive, the journey becomes much harder. So how important is family involvement in coordinated bariatric care?
Well, family support really significantly impacts compliance and emotional stability. There is no question about that. You know, there has to be a solid support system for the patient to thrive in their own success. Coordinated education helps families understand dietary changes, recovery expectations, and also emotional transitions. These are not easy to understand unless you've been educated on them. You're seeing your loved one go through some very drastic changes, physically and mentally, in the way they eat, in the way they approach food, in the way they communicate about food, right? All these things will be much easier to deal with if the family is also involved in the educational process. So it is important for us to also make sure that family is well involved in this, that the household as a whole understands how to support long-term outcomes, long-term success as outcome of bariatric surgery.
So what we also see is the weight gain, weight regain. It may be just because they lost a lot of weight and then they are gaining some back. It may be in different stages, but what we know is this is something that needs to be discussed openly. Some patients may experience partial weight gain years after surgery. This should not be immediately treated as a failure or blamed on the patient. It just requires reassessment, as our body is extremely smart and makes a lot of good adjustments and bad adjustments at the same time. So what we know is with our care coordination team is that nutritional habits, psychological stressors, and hormonal changes, physical activities, and possible surgical factors may be the reason for these weight regain. So coordination allows intervention before regain becomes severe. And the goal is problem solving, not punishment.
Yes.
So we want our patients to remember this. And that takes me to my next topic on this is the lifelong care. So bariatric surgery is not a short-term treatment, as we discuss all the time.
Yep.
It's not simply have surgery and move on.
Absolutely.
Patients need monitoring for years. And this doesn't mean that intense monitoring is just like this a checkpoint. So you need to be able to come in, see what's going on. Like I had my own follow-up visit with my doctor, with my primary care. I don't have any regular routine or chronic problems. And he wanted to have a follow-up. There was some like blood work follow-up needed. Didn't do my colonoscopy, so we need to talk about that.
Okay.
I may call Arvind after this, so we need to schedule that somewhere in Philly again, but not at the last place.
No, last place. Okay.
So, but then he said, you have to do it. You don't have a choice. And some of the blood work needed to be repeated. Fine. And I don't have any issues with any of these.
Of course.
But we didn't follow up. So, meaning that these shouldn't be, like, patients shouldn't feel like they're a victim, because you and I, we always discuss that everything that we are asking them to do at a different scale, we do it.
Of course.
Intermittent fasting for how many years?
Yes, of course.
You know, I had today, I had 15 hours. Well, 16, because the first food at 1 p.m., so 10 a.m. Okay, so I'm not a bariatric patient. I didn't have a surgery, right? But we do it.
Yeah, absolutely.
I walked this morning.
Yeah.
So not because I had surgery and I need to lose weight. It's just to be able to keep off what we have.
Of course.
So this, victim mentality needs to be off the table. So patients really should have a good understanding of that.
Absolutely.
So how do bariatric programs transitions patients into lifelong maintenance care?
So essentially, successful programs established a structured long-term follow-up schedule with nutrition monitoring, laboratory testing, behavioral support, and primary care collaboration. So, as you said, bariatric surgery is a chronic disease, and the model it should be based should be on a chronic disease treatment model, not a one-time procedure. So that is very important. So having that structured follow-up program based on different components of the bariatric team, really making sure that the follow-up occurs is what a modern successful bariatric program should do. I do want to touch on a point that you mentioned earlier on, Kemal, which is very important, and that is the issue of weight regain. And we have to have a sense of proportion about that. It's not always a failure. Let me give you an example. Let's say you have somebody who is 5'5" tall, right? Let's say they come to bariatric surgery at 350 pounds, right? That's almost 200 pounds over their ideal body weight. They have their gastric sleeve. A year and a half later, they're down to 150, right? Now they have a normal BMI. To everyone who knew them, they look extremely skinny, right? The patient is comfortable, they are confident, they're doing well. Let's say 5 years later, that patient comes to our office and now the weight has gone to 180, okay? That is a significant regain, but we have to have a sense of proportion. Where was that patient before? They were at 350. So they may be able to actually live comfortably now at that 170 to 180 range. They may not, it may be very difficult for them to go back to the 150, and for us to hit our head on the wall and them as well, because now they're not 150, makes no sense at all, right? We have to praise them for having come down from such a high weight. We have to praise them for having maintained now over 180 pounds off, 170 pounds off from where they were, and make sure they don't gain anymore. So, as you correctly said, we shouldn't penalize patients just because they gain a few pounds. We have to make sure we understand where they've come from, where they are right now, who they are held, and encourage them to stay there. That's very important.
That's actually such an important point, Dr. Irgau, because in the ACO case conferences, not the ASC, but the ACO, we have our nurses. Sometimes we have new nurses, and then when they present a patient, and then I see, especially when they said, "Oh, this is a post-bariatric patient," but then they may need to have bariatrician follow-up, and they use the term, "Oh, patient is gaining weight." And then, in our system, in Power Chart, Oracle, it goes like certain time, like it's like 6 months, 8 months based on your setup. So if you don't change the date range to like 5 years, you don't know what the starting point. And I always have a great pleasure to show them, hey, this patient is gaining weight now, but this patient was 320 pounds, lost 140, gained 20 or 30 or 40, but this is where they were. So because I'm maybe taking a little bit defensive approach, saying that, hey, like bariatric surgery always works, so if there's a failure, there must be some other issues. But first thing is we change the date range.
Absolutely.
Because we need to see where they were before.
Absolutely.
So there was a patient just this week, it was 390 pounds, down to 215 or 217 my weight right now. Maybe, a little bit off, 217. So that's how I remember the number. But I'm like, this patient lost, I asked Faith, like, are you more than, this? I mean, are you less than this? The number of pounds was lost was more than Faith's overall weight.
It's one person.
That's like big. That's big.
Absolutely.
Now, this is all about, again, it just comes down to the patient education as well and the expectations. So education is one of the most powerful tools in the process. And when patients do not fully understand what surgery can and cannot do, they may struggle afterwards.
Absolutely.
Clear education helps patients make better decisions and recognize the problems early on. So how does education improve coordination and patient outcomes?
So essentially, educated patients make better decisions and recognize complications earlier. That's really what is clearly important here. Coordinated education programs prepare patients for realistic expectations about their weight loss and about their journey, about the dietary restrictions they may have, what exercise requirements there may be in terms of them staying active physically, and also how to adapt emotionally. All these are important things that can be covered with a good program that really heavily invests on education of those patients earlier on. And clear expectations reduce confusion and improve compliance. And we talked about follow-up, we talked about emotional stability, we talked about avoiding nutritional mishaps. All those can be prevented or minimized if patients are empowered. And the best way to empower patients is really to educate them.
And that's why we are doing these YouTube sessions,
exactly,
right?
Exactly, absolutely.
So the future of coordinated bariatric care is our final topic today. So obviously healthcare is changing quickly. There are always new stuff happening, and we are seeing more digital tools, telehealth, wearable devices, integrated electronic records, AI-supported tracking, and predictive analytics. So these tools may help us identify the problems earlier and keep patients more engaged. So what does the future of bariatric care coordination look like for you?
So it will implement many of those elements that you've mentioned. Future systems will rely more on telehealth, wearable monitoring devices, integrated electronic records, AI-supported tracking, and also, as you said, predictive analytics as well. And these tools placed properly will help us in many ways. They may help us to detect nutritional problems much earlier than the appearance of systems. They may help us track non-compliance and therefore get back to the patient for that the compliance is improved. And also they may help us find out about complications much earlier. Overall, that is going to help really improve the long-term success of what we are doing right now. In essence, we will be more connected with the patients, right? Because we have many ways for really following them up, following their vital signs, following their nutritional status, following their blood work.
So now the fun part.
Okay.
This used to be rated with Dr.Irgau, but we can also call this as kill it with Dr. Erkan. Killing all the pronunciations of all these good food. So Ethiopian food is what we have today. So Dr. Irgau, where are you from?
I am from Tigray,
right.
which is a region that is currently in Ethiopia, but I hope one day it will become an independent
country. Are we
country.
Be independent?
Well,
are we allowed to go to Ethiopia now?
Yeah, of course.
Good.
Of course, we are all.
I thought we were banned at some point. So here's where I'm going to actually destroy these names, and I deliberately did not look into these names, so then I can destroy with my.
I am sure you will do well.
So the first one actually is kind of easy. So injera. Are we ready, by the way?
Yeah.
So that is perfect.
Injera.
That's
right.
good. Yeah, absolutely. What is it? So this is a fermented sourdough flatbread, primarily made by a cereal known as taf or tef. I would rate it 7 out of 10. And the reason is because it contains fiber, it contains iron, it has beneficial fermentation. It's more nutrition than many breads that you may find around the world. For post-bariatric patients, and that's why I rated it's a little bit, lower rather than 8 or 9, is because it is certainly healthier than white bread, but it is still carbohydrate dense, and that's something that is important to understand. So our bariatric patients, if they indulge in injera, they should do it with moderation.
All right, so the next one is Dorawat.
You got it, Dorawat. That's very good, yeah. That is 9 out of 10. This is a good choice. What is it? It's a slow-cooked, spicy chicken stew. with a spice known as berbere to make it really very spicy hot. Often it will have boiled eggs as well with it. It's an excellent source of protein. It's highly satisfying. It's rich in flavor and lots of micronutrients as well. For our post-bariatric patients, excellent choice. One of the best choices from the Ethiopian cuisine. They just have to watch its oil quantity. Sometimes oil can be a little bit overwhelming there.
Right.
And this is a food that is eaten typically on holidays.
So the 4th of July is coming. Misir what?
Misir what?
Misir
Yeah.
what?
Misir what? Misir is like
corn?
No, actually it's
In Turkish it's
lentils.
corn. Oh, lentil. Okay.
Okay. Misir is okay.
Okay.
It's lentils. Yeah. 9 out of 10. This
9
is an
out of 10.
excellent
Actually,
choice
Dr.
as well.
You're
Yeah.
kind of being biased.
No,
on
no.
this.
Well, we will come to some not so good ones in a
Okay.
little bit, but this is actually very good. Why? It is spicy red lentils cooked slowly with onion, garlic, and this spice known as berbere. It's rich in fiber. It has plant protein and folate as well. Excellent for our post-bariatric patients. It has a soft texture and it's also highly satisfying. So it's a good choice.
So far, like bariatric patients should just try Ethiopian food.
There you are.
Good. Next one is Tibbs.
Tips, yeah, you're doing very well. 8 out of 10. What is this? This is cubes of beef or lamb that are sautéed with onions, peppers, and spices. It's actually a fairly quickly prepared meal, and it has high quality protein, zinc, and vitamin B as well. For our post-bariatric patients, it's a very good choice. It's a very good source of protein. Obviously, it's an excellent choice. They just have to make sure it's more on the leaner cuts as opposed to the fatty ones. And they obviously have to chew it thoroughly.
Sure. So, next is Gomen.
Gomen, that's good as well. 10 out of 10. Okay, this is an excellent choice. It's collard green,
here.
cooked with garlic, onions, and spices. It's extremely nutrient dense, high fiber, low calories, rich in vitamins like A, C, and K. For our post-bariatric patients, I would say it's an outstanding choice, one of the healthiest side dishes that is available.
All right. So, is it Kitfo?
Kitfo, that's very good. This is 7 out of 10. So Kitfo essentially is a finely minced raw beef. It's essentially like beef tartare, but very, very thinly minced. Sometimes it's lightly cooked, but very often just raw with
So the meat is raw?
raw, yeah. So raw, but sometimes it's lightly cooked. So you can ask whichever preference you have. Right? Personally, I like it lightly cooked. My son, who loves this, he loves it raw, for instance. It's an excellent protein source, iron, B12. The one question here is that there is a lot of butter in this dish, so the fat content is a little bit high. So for our post-bariatric patients, I would say be moderate with this just because of that richness in fat.
All right. Next one is Shiro.
Good one. Shiro, you've said it. 8 out of 10. What is this? This is a smooth chickpea stew seasoned with garlic, onions, and spices. Good plant protein, again, chickpea. Fiber and minerals are plenty. For our post-bariatric patients, it's a very good choice.
All right. I love this next one. Furfur.
Good one. For you to say it, but bad as a choice.
Come
It's 3
on.
out of 10.
Furfur?
Yeah,
No
furfur essentially is torn pieces of injera, right? They cut them into very small pieces, and they saute it with spices and sauce. Basically, it's primarily carbohydrate, very little protein. Poor choice for our post-bariatric patients.
And poor choice for Ethan as well. And this one is tough. Ata killed what?
Very good. So what is something that's recurrent, right? We said doro what before. Now we're saying atakiltu what. What means essentially stew. essentially. So this is a stew of vegetables, essentially, made with cabbage, carrots, potatoes, and spices. And in terms of rating, I would say 8 out of 10. High fiber, nutrient rich.
No unhealthy Ethiopian food.
No, we just said fırfır.
That flows from the name fırfır.
It's for post-bariatric patients, it's a very good choice. Sometimes they may add some potatoes, which increases the carb content. So, but overall, it's actually a very healthy choice.
So this one actually means shame in Turkish. The next one.
Oh, really?
Ayıp.
Shameful.
Ayub really is actually a 9 out of 10.
Oh.
This is mild, fresh cottage cheese that is usually homemade. It's high in protein, calcium rich, and low in carbohydrate. Post-bariatric patients, excellent choice, particularly early after surgery, because it has a very soft texture and it is an excellent protein source.
All right. Well, we are at the end of Rated with Dr. Irgau session. So, and also end of our episode today. Dr. Irgau, thank you for joining us today.
My pleasure. My pleasure.
So
Kemal.
today's
Good session.
discussion really shows that bariatric surgery's success depends on how much more than just the operating room. The operation is important, of course, but the long-term success comes from structure, teamwork, education, follow-up, and coordinated care. Effective care coordination helps patients move safely through every phase of the journey, before surgery, after surgery, and after the years afterwards. So thank you for watching us, and thank you for joining us. And of course, please subscribe for the channel, join our conversations on obesity treatment, surgical care, and along with the long-term health management. So until next time, please stay united. Bye-bye.